and they put Gorsuch on the Supreme Court to get through. Couldn't get them through with the 60 votes. Using the 60-vote rule, they circumvented the rule, and they decided to go with the majority vote rule, 50 votes plus one or more. They can do this. Whenever they get ready, they can do it. And I prognosticated when we last talked about this, I prognosticated that eventually they will do that. That this is where we're headed. Eventually, in my opinion, they will at some point use what is called the nuclear option. Now that's said to scare you, to make you think that it shouldn't be done. But they do it when it's something they really want to do. So if they wanted Gorsuch on the Supreme Court, and I think it was okay for them to get Gorsuch on the Supreme Court with the 51 vote rule, 51 plus votes, and they wanted persons in these various positions. When they wanted these things, they have made them a priority. Well, the question is this: is the health care a priority for you? You have the power. You started it. You started it. You can finish it. You can end it on any day without a single Democrat voting for it. So I would say to my Republican colleagues, it's time for you to face a public that understands that you have the power. Because I think it's a good thing to say that they have the House, the Senate, and the presidency, they've got the power. I'm giving you the rationale behind why I say they have the power to do it. So the public needs to know this, and the public needs to look at them as the people who not only have the power, but because they didn't use it appropriately, they started this crisis that I see as a scam, as a means by which the president can do some of the dastardly things that he couldn't do otherwise. My hope is that this will end immediately, if not sooner. It should never have started. Now, this is going to have an impact on SNAP. SNAP is a program that some 40 plus million people can benefit from. SNAP has been a program that has served us well, and according to my notes that I have with me today, on October the 10th, the USDA sent a memo to states indicating that there was an insufficient funds for benefits for November. And the USDA directed that the benefits be held up until further notice. Now, this is USDA talking about SNAP. Well, SNAP has a contingency fund, and there currently is about $5 billion in this contingency fund. This contingency fund can be used, but if it is used for a partial payment, then I see that as a cut. That is a cut in the benefits. We don't want to see a cut. We want the entire $8 billion, which is about what it will take per month, to be paid out. And for the $8 billion to be paid out, so that some 40 plus million people won't lose their food opportunities, there needs to be a lawful means by which the additional monies can be put into the fund so that we can cover all of November. Again, this is a crisis that they created, and it is a crisis that they can end, and they can see what's happening, but they'd rather play the blame game and blame Democrats when they don't need a single Democratic vote. They keep saying they can't get Democrats to do it. Well, you don't need Democrats to do anything. You should do it yourselves. That's most appropriate. Now, we already have discussed, and it's been discussed enough for everybody to have some sense about it, so I'll be very brief on this. The health care. We want to see, I do, and all of the people who agree with me, we want to see the health care benefits restored. We want to see it. Now, there are people who are saying that you should not allow people to go to an emergency room if they're hurt. I'm not one of those people. If you're here in this country, I'm speaking for myself. Do not attribute this to the Democratic Party. If you're here in this country and you are sick, I want you to get some health care. If if we should wound a person who's robbing a bank, we will give that person aid and comfort. If you engage in mortal combat with us and we should harm you in the process, we give you aid and comfort. So I believe that if you're hit by a car and you need some aid and comfort, I'm a person who believes you should be given aid and comfort. That means that you're going to go to the emergency room if you don't have health care. That means that we're all going to pay more. I understand this. But I'd also understand that I'm just not the guy who's going to say, let him die in the street. That's not me. I won't say that. People who get hurt and need emergency care ought to get emergency room care. There are also people who are saying that, well, it's about high income earners benefiting from the program. High income earners. It was originally designed to accommodate people who are making around $125,000 a year for a family of a certain size. Well, when the COVID hit, as it did, and everybody's aware of it, that cap was lifted. Well, here's my position on that. Let's negotiate. That's what negotiation's all about. You don't want to negotiate. You don't want to open the government. What you want to do is give the president the opportunity to do these dastardly things that he can do when there's a shutdown. And he's doing them. So if you don't like the numbers, and I'm not going to give you a position one way or another, I won't negotiate by way of the media. I will simply say to you, Al Green is willing to negotiate with you. But I won't say to you that we should do nothing. Those benefits are going to help a lot of people. More than 90% of the people will get benefits that will be within that $125,000 range. I want to see those people get those benefits. In a state like Texas, people are going to start to get these notices, and they're going to be shocked when they see how much more they're going to pay in their premiums. They're going to be shocked. In their co-payments, they're going to be shocked. The sticker shock doesn't have to exist. It exists only because my Republican colleagues choose to shut down the government, and then they choose not to negotiate with Democrats. Well, at some point, we're going to have negotiation become negotiation. Because you see now, my Republican colleagues have confused negotiation with something called capitulation. Capitulation. They say, here's what you can do if you'll vote for it, and we would appreciate if you would. Very kind and courteous about it. We would appreciate if you would. Well, that's capitulation. If you give me take it or leave it, highway or no way, that's capitulation. That's not negotiation. That's not cooperation. We want negotiation. We want cooperation. So I'm willing to negotiate and cooperate. I'm willing to give to get. I believe in give and take. I've never had my way in life. Having been born an African American in the United States, I've had to make concessions most of my life about most of the things that I've had to deal with. By the way, it's not unusual for people of color to have to make concessions. We don't have the power to make the demands that some others can make. So you're talking to, if you're looking at me and you want to talk to me, you'll be talking to a person who understands how to negotiate and is willing to negotiate. But under no circumstances am I going to capitulate and have some millions of people not get the proper health care. Some people will die. Other people who don't get health care, they lose their health care. They're going to go to emergency rooms. Then we're all going to pay more for our health care. It impacts all of us. I think Dr. King's statement about this in an indirect sense, he wasn't talking specifically about health care when he made this statement, but he reminded us that life is an inescapable network of mutuality tied to a single garment of destiny. What impacts one directly impacts all indirectly. So we're indirectly going to suffer if we don't do something to help with the healthcare crisis. So we've got the SNAP crisis, which deals with food, and then we've got the healthcare crisis. One final thing. If my Republican colleagues was so enthralled with SNAP, they would have allowed the amendment that was brought before the Rules Committee. I was there to present it myself. I arrived there around 2 a.m. Don't hold me to the exact time, please. Around 2 a.m., stayed there for hours, presented that amendment to help people who get the SNAP benefits stolen because of the cars being hijacked, lifted from them, stolen. We had a legislation to help, to restore that so that people could continue to get their benefits. The Rules Committee did not put that in order. These were Republicans who voted against that. Couldn't get that done. So I don't see my Republican colleagues being as enthralled with SNAP as they appear to be. Ostensibly, they are people who want to see things happen, but in reality, when they have an opportunity to do something about it, they don't. I welcome your questions.
Congressman, what's your prediction? How long this is gonna go on?
I predict it will go on until the Republicans decide to end it. They have the House, the Senate, and the presidency. They could have prevented it from starting. They have the opportunity to end it any day that they want. They could have ended it on day one, because all they had to do was use the same rule that they used to put Gorsuch on the Supreme Court. Use that same rule that they used to put Gorsuch on the Supreme Court to end the shutdown or prevent it. They could have done it, and they can still do it. And that is a fact. That is a fact. It has not been highly published for reasons that I will not venture to deal with today. But at some point in the future, I'll explain why. But they have not highly published this, people who can, and I regret this. But if this were highly published, I think Republicans would have a different attitude.
If the government continues being shut down on November, thousands of Texans won't be able
Yes.
to get their money,
Yes.
their dollars to buy food. Is there something being done to try to help to create places where people can get food, or how is that gonna work if they don't
Well,
get their money?
thank you. The food pantries cannot handle the sheer volume of people. They cannot. And by the way, they don't have the volume of food that they used to have. So there are two things working against them: the sheer numbers that will be in need, and then not having as much as they used to have to distribute. So they are persons who are going to have to do as best as they can. I'm talking about the food pantries now, to serve as many people as possible. And I believe that they will do this. They will serve as many as they possibly can. But I do believe that the solution is before us, and the Republicans have it within their power. They would rather talk about how people are going to starve than simply go back to Washington, D.C. and vote to end the crisis. The House has not been in session now for some long period of time. The Senate only votes to have Democrats, to try to somehow embarrass Democrats, it seems. But they don't need to do this. They have the power to do it, and they ought to do it. Okay, I'm just being told that I'm going to have no official votes next week. No official votes next week, so there'll be another week for my colleagues to vacation. But Democrats are coming to Washington, D.C., and we will be there with hopes that my Republican colleagues will have a change of heart. I'll be leaving to go to Washington, D.C. For a meeting that we will have, Democrats will have, and we'll continue with trying to do what we can to encourage our Republican colleagues to come to work in Washington, D.C., where we can vote, where we can negotiate, and we can bring this crisis to an end. But make no mistake about it, They don't need a single Democrat, not one, to end this crisis. It shouldn't have started. All of these people shouldn't be suffering. But because they choose, it's not a priority for them. Gorsuch was a priority. Getting people appointed to various offices was a priority. But this is not a priority for them.
So what you just received, that
Yeah.
means that next week there won't be a vote or any negotiation that might end?
Well, I won't say there won't be, but I will say that we've got an indication that there will be no votes, yes, next week. Well, I should say that the House is going to be closed next week. I don't know that if he could open it up. You know, the Speaker has the power. If he chooses to open the House up, he can. But it reads here that Leader Jeffries has requested members to be in Washington, D.C. by the evening of Tuesday, October 28th, ready, willing, and able to vote for a budget that fights the Republican health care crisis and keeps the government open. Members should remain flexible throughout the week. Please use this, this form will close on Friday, October 24th, 2025 at 6 p.m. That's something else. Let's see. Well, it looks like they won't be there based upon what I'm reading, but I'm not sure that that's the case. The Speaker has the power in his hands. So don't take what I said as the last word. Okay, the next question, please. All right, well, no other questions, then let me just say, reiterate, and I hope that some station will carry this. It's interesting that I saw a member of the Senate say this, and it was carried. I saw a member of the House say it on Fox. Fox carried it. I think the station that the senator was on was either MSNBC or CNN. But I just hope that the local stations here, some local station will carry this. I said this, by the way, some time ago when I first embraced this issue to call it to the attention of the public. This was on October the 2nd. I said this, but somehow it has escaped the attention of the people who can make it known to the public. The good news is that the live streaming will get it out. My hope is that my friends who have the power to publish this will do so. And then let my Republican colleagues refute. Let them explain why they're not using the same rule that they used to put Gorsuch on the Supreme Court. Let them explain it. And then come back to me and get my retort. Because I know what they're going to say, but I'm not going to say it for them. And I have a retort prepared for them. Because this rule is something that is used when it's convenient and when they want to do it, not when it's needed.